Okay, so this is a talk about expert elicitation, but I also think about it as being a talk about the capabilities and limits of models and what models can and can't tell us in the area of AMR. So it's based on work which I did a few years ago. So there's a case study. The case study is somewhat out of date now, but hopefully the issues are still relevant, and this is really a hook for discussing these issues. So just to do some of the obligatory introduction to AMR in case anyone is joining us fresh. Every time you have an infection, there's a chance of resistance evolving, and antibiotic use selects for resistance. That means that, well, what you see is that after antibiotics are introduced into the healthcare system, sooner or later, resistance emerges. So this is from the One Health Trust, or CDEP as it then was, and it shows you the length of time from the introduction of an antibiotic to the emergence of resistance to that antibiotic for selected products. So you can see sometimes it's a long time, sometimes it's a short time, but sooner or later resistance always gets you. And our former Chief Medical Officer, Professor Dame Sally Davies, has been one of the, I think, opinion leaders, not just in the UK, but also globally. So she has talked about the soaring number of antibiotic-resistant infections. Threatens us to take us back to a 19th century environment where everyday infections could kill us. So the homework question that we were given, for which motivates the study in this talk, is how do we actually predict what resistance rates are going to be in 20 years' time, or whatever, in the kind of medium to long range future. And when you ask people these questions, they normally come up with three answers. So one of them is statistical forecasting, which is what many picky-oriented people suggest as a kind of first cut. There's expert judgment, and there's dynamic disease modeling, which I'm not going to talk about. The dynamic disease modeling I'm not going to talk about except briefly. So I'm going to focus on the first two, and within the first two, I'm going to focus on the second one. So let's talk about what statistical forecasting can tell us about the future spread of AMR. And this is, we used years-net data from the European Centers for Disease Control. So this is a number of different versions of ETS run on years-net data. I've forgotten for which country it is, but I'd like to draw your attention to three features. So one is, depending on exactly which flavor of ERS you use, you get extremely different answers out. You get different answers both in terms of the gradient of the curve, and also different answers in terms of the prediction interval. So that's item number one. I'd also notice that I'd also encourage you to note that many of these forecasting models, because they are extrapolative, lead you to 100% resistance, which is not biologically plausible. And then the third thing that I'd point out is that all of these, because they are based on extrapolative models, they are continuously increasing, right? So they just go up and up. And we know that if you look at resistance, what happens to resistance? So this is MRSA. So I came into my first exposure to AMR was way back in a long time ago now, when the UK was getting to grips with MRSA. And what you see with MRSA is very, very pronouncedly, it goes up and then it goes down. And that didn't happen by chance. That was because the UK had a really big push to get to grips with MRSA and to encourage hand washing, and to ensure that there is beefed up resources for infection control and board level representation of infection control in hospitals and all sorts of things like that. So what often happens with problems is that, you know, as soon as there is serious attention given to the problem, then the trend changes. So these simple extrapolative models, maybe you might say that they're good. If you want to tell a story about, look, things can get really bad, things are getting worse, and if they continue, they'll get really bad. Yeah, although I'm not even sure that they're terribly good at that. But they're not very good at telling you what's actually going to happen, which is also quite an important question. And often the reason that people want predictive forecasts is because they want to know what's your best guess of what's actually going to happen. So this kind of leads us into the story of our paper, which is a story partly about these statistical models, but primarily about the use of expert elicitation and expert judgment, precisely because statistical forecasting does have these significant limitations. And to some extent, that's the problem of the data limitations, but also I think it is to some extent fundamental intrinsic limitation of extrapolative forecasting. So I'll say a little bit about expert elicitation. So you may or may not be aware, but expert elicitation is a thing. There is a kind of body of methodology research on how to get the best inputs from experts, largely developed outside the healthcare setting, developed in areas like nuclear safety, environmental management, and so on. So when do you use expert elicitation? Well, firstly, normally it's because there is a policy need. You have some amount of time and money, but possibly not enough to do a randomized control trial, if indeed doing a randomized control trial is even possible. And critically, you have people who know something, but no one person who knows everything. So with apologies for those who attended the session this morning, there's a kind of domain of maturity of our knowledge about things. And that goes from things where we do genuinely know everything. So NCDs, we can come up with pretty good short-term forecasts of NCDs because NCDs are primarily driven by the age structure of the population and some other things. And we know how the age structure of the population is going to change in the short term, particularly for the elderly population, because the elderly population of in 10 years' time are already alive and walking around today and are with us. So yeah, so how many knee replacements in Singapore in 2028? That's a question that we can come up with plausible answers to pretty easily. At the other end of the scale, there are things which nobody knows the answer to. So how many global pandemics are there going to be in the 22nd or 23rd century? We really do not know the answer to that question. I mean, there's just no way of really knowing the answer to that question. And we don't know even the kind of fundamental precursors to the answer to that question. We don't know what vaccines are going to be like in the 22nd century. And then in the middle, there's stuff where we have multiple different ways of thinking about problems. People have different opinions. No way of thinking about the problem is the single best winner, the single best way. So we have this kind of halfway house state. And this is the sort of area where you might want to use expert elicitation. There is knowledge, the knowledge is fragmented, the knowledge is not conclusive, it's dispersed, distributed in different ways in different types in different scientific communities. It's worthwhile to say that science does actually progress. So things move along this continuum. The early studies of expert elicitation were done on weather forecasting. So there, the question was, how do you interact with human experts to get human experts to give you the best possible weather forecasts? So this was work done by Alan Murphy and other people in the 1970s. We now don't use humans to do weather forecasting. We have computers which do weather forecasting for us. So weather forecasting has moved from the middle to the settled science end of the spectrum. Similarly, if you'd asked Isaac Newton to think about forecasting AMR, he wouldn't have been able to do it at all. To think about AMR, you need to have the germ theory of disease. You need to have an idea of what an antibiotic is. You need to have the theory of evolution. You have to have various bits of conceptual machinery. And as long as you don't have these things, AMR is going to lie out there in the how many pandemics in the 22nd century sort of territory. So I wanted to kind of motivate the use of expert elicitation. There's a question about who is an expert. So an expert is someone who has special knowledge of a particular field. Niels Bohr said an expert is someone who's made every mistake in their field. Will Rogers said an expert is someone who is 50 miles from home with a briefcase. I think one of the things which these definitions highlight, these ideas highlight, is that it can actually be quite difficult to tell who is an expert. So an expert is someone who has special knowledge. But how do you know that? You can't look inside people's heads. You can tell whether someone is 50 miles from home with a briefcase. That's easier to objectively recognize, but actually it's not really a terribly good proxy for whether someone is an expert. And you could even suggest, you could even ask, is an expert really a person? Is expertise really something which resides within scientific communities? So Etienne Wenger, the man behind Communities of Practice, has made this point. So our knowing is always too big, too rich, too ancient, too connected for anyone to be the source of it individually. So I think there is an important idea here, and that idea is that expertise is a property of communities. And this leads us into one of the big ideas in expert elicitation, which is that it's not normally a good idea to rely on a single expert. The reason that you're going to an expert is normally because there isn't a single settled answer. There are multiple competing answers which different people have. And so it's a good idea to select a number of people and to select a number of people who are diverse. So if you select people who all come from the same lab or who are all doctoral students of the same supervisor, then it may be that you will get 5 experts, but between them, these experts only have 2.3 opinions. So these definitions, I think they all get us to something in terms of identifying experts. The particular approach to expert elicitation, which we used in this study, is something called Cook's approach. One of the reasons for using this is, well, because we are friends of Cook, but Cook is a very convincing person, has some very convincing arguments. And Cook wrote a great book, which I do recommend, if you can find a copy, called Experts in Uncertainty, published in 1991, where he lays out his ideas about the philosophy of science. And one of the things which he says is the hallmark of scientific inquiry is quality control, some form of quality control, some form of validation. So Cook has this whole big thing where he says, well, you know, when we do data, we do all sorts of quality control on the data, but often when we get input from experts, we don't do any quality control at all on the expert inputs. Wouldn't it be great, he said, if we did quality control on the experts? And then a big chunk of his career was spent trying to figure out how to do this quality control on the experts. So this is a picture of Cook, by the way. So the idea in Cook's method is that you ask experts 2 sorts of questions. You ask them the target variables, the things which you're actually interested in, and you ask them what are called the seed questions or calibration questions, which are questions to which you do know the answer. And then you use these calibration questions to determine weights, and then you weight the experts' answers to the target questions based on their performance on the seed questions. So there is a intrinsic problem with this method, which is the identification of the seed questions, because to identify seed questions, you have to find something in an expert's domain of knowledge, which you know, but the expert doesn't know when you are not an expert. So this is often tricky, complicated to do. The way that we did it in this study was we asked experts to forecast ECDC, EARSnet data in the weeks before that data was published. So we're asking them to do a forward forecast. We're asking them to do a forward forecast. Oh, thank you, Lynn. I got carried away. We're asking them to do a forward forecast. And the way in which we're constructing the seed questions is by asking them about current or recent historical data, but current or recent historical data which has not been published at the time that we asked them, so they could not know. So that was the logic. We got experts from 4 countries. Originally, we had 5 countries, but we couldn't find enough experts to answer our questions in Germany. And we asked them for about 9 bug drug pairs, which you can see on the screen here. And this is the results for E. coli and fluoroquinolones for the 4 countries. So this, I think, is the performance-weighted aggregated judgments from the different experts from the different countries. You can see there's a Bayesian credible interval there. So the UK experts seem to be a lot more uncertain than the Italian experts. They're giving us much wider probability distributions. You can also see that there is there is non-monotonicity. There is a downturn for many of the experts, and this is because and the experts also tell us why they think this, and typically, you know, it is because they say, well, you know, this particular thing has been a priority recently. We have been investing in this. We have been putting in place measures which we think are going to work to get control of the situation. So, you know, we have all these different bug drug pairs which give us different. So carbapenem resistance, they thought that would remain fairly low, for example. Of course, this was done before COVID. The experts didn't know that COVID was going to happen. You know, maybe we might want to go back and take a look at how their forecasts performed. Yeah, I mean, and you can also see, okay, so MRSA, as I said, you know, the marked feature of MRSA in the UK was that it declined very sharply once the Department of Health really decided it was going to crack down on it. So experts thought that decline would be sustained. Here's the expert scores on the performance measures, which are used to derive the performance weights. So Cook's method is based on scoring method, which measures 2 things. So one is statistical accuracy. So if you give me a 50% credible interval for a seed question, how often do my 50% credible intervals capture the true mean? It should be half the time, right? So it looks at that, but it also looks at how so-called informativeness, so how concentrated my distribution is, because we don't want people who are getting very accurate distributions, but giving us very wide ranges. We want people who are giving us focused, focused, credible, Bayesian credible intervals. Yeah, so, and this is for, I've forgotten what country this is for, actually. Yeah, so, I mean, I think there's often, when people talk about hierarchy of evidence, they often talk about expert judgment being the lowest form of evidence possible. So all the way down at the bottom, below non-experimental descriptive studies, and that's okay, you know, if you have these higher level forms of evidence, possibly. But for many questions of interest, expert judgment is all you have. So the idea in expert elicitation is, you know, you really should think about ways to elicit that in the best way possible. And if you're Roger Cooke, you say one of the components of ensuring that your expert elicitations are elicited in the best way possible is to use these quality controlling seed questions to make sure that your experts are good judges of uncertain quantities in this particular area. And we have a couple of books. So one of the rules in health economics is that all roads lead to the University of York eventually. So we have this book on we have this volume in the Health Technology Assessment series of NIHR, which is by a number of people, including Marcus Warsh, actually. So we had a project funded by MRC Methods Program on use of expert judgment in healthcare decision making, which produced this report on the right hand side. And slightly fuzzy picture, we have this this book, which we did as part of a European Science Foundation funded network, elicitation, the science and art of structuring judgment. I have to say that the value for money, if you're comparing the value for money of these two books, the book on the left is very expensive, and the book on the right is free. So the value for money of the book on the right is in fact infinite, whereas the value for money of the book on the left, whatever it is certainly finite. Yeah, so the book on the right is an easier one to access. The book on the left you might want to recommend for your university library rather than buying it personally, considering the whopping price tag.